Tired of the same old political shouty matches and talking points?
Looking for thoughtful conversations that go beyond the headlines and help you understand issues that matter?
I'm Sarah.
And I'm Beth.
Together we host Pantsuit Politics, a podcast where we bring grace, nuance, and perspective to the news because democracy deserves more than hot takes.
Join us as we approach politics and current events with curiosity, empathy, and a commitment to understanding the bigger picture.
If you want to stay informed without the anxiety, we're the show for you.
New episodes drop on Tuesdays and Fridays. Subscribe to Pantsuit Politics wherever you get your podcasts.
Welcome to Repros Fight Back, a podcast on all things related to sexual and reproductive health rights and justice. Hey Repros, how's everybody doing? I'm your host, Jenny Wetter, and my pronouns are she, her. So y'all, I am still dealing with this stupid cough. It is still working its way out. It is mostly gone, but it is still around enough to really annoy me. So sorry if you hear some wheezing. I am very excited. I am recording this the week before y'all are hearing it because I am at the annual American Public Health Association conference this week. So if you're at APHA and you hear this when it comes out, swing by our booth. Make sure to come say hi. I always love getting to talk to people who listen to the podcast. It is honestly one of my favorite parts of going to APHA is getting to meet a bunch of people who love the podcast. It just makes my heart so happy. And I love meeting y'all. It brings me so much joy. I don't know what to say. It's wonderful. So we are doing something special for y'all now. So we're doing this at APHA, but I wanted to make sure that we are also doing it for everybody who is part of our audience. So we are doing a merch giveaway. What? So if you love our merch, well, first you can go ahead and buy some, but also we are doing a fun giveaway. So if you would send us a tweet or Blue Sky or whatever your favorite social media platform is, tag us and tell us either why you love the podcast, because I always want to know. I always want to know what about it makes you happy. Or you can tell us why you fight for sexual and reproductive health and rights. And each time you post equals one entry. So if you post 4 times, you get 4 entries into the giveaway. Just make sure to tag Repros on whatever social media platform you share. You can do a video. I would love to see a video. You can just write a post. You can make a graphic, whatever makes you happy. Send it to us in the next 2 weeks, let's say, and we will enter all of your entries into a giveaway, and we will reach out to you and make sure you get a bunch of fun Repros merch. How fun is that? I am so excited. I can't wait to get more merch into all of y'all's hands, but also merch makes great gifts. So if you want to go and buy some from our bonfire store, please feel free to do that as well. I'm sure we will be posting about it on social media, so just keep an eye out for that and you can learn more details. But really, just tag us on social, tell us why you love the podcast, or tell us why you fight for sexual and reproductive health and rights. And each time you post, you get 1 entry into the giveaway. Make sure to tag us so that we see it, so we know what happened, and we'll put your entry in the pot. Okay. I'm so excited for that, y'all. I'm so excited to see people who are at APHA. Like I said, I love meeting our audience. It really does make my heart happy. I love when y'all email or reach out to us on social. I just love hearing from y'all. It really does make my day a little brighter. So thank you. With that, I don't really feel like I have a ton of other things to talk about. I honestly feel like I just recorded the intro for last week's episode. Almost kind of did, but that's okay. So let's just turn to this week. This week, we haven't talked about global in a while and what is happening around global sexual and reproductive health in a little while. So I'm very excited to have join me today Anu Kumar with Ipas to talk about the state of sexual and reproductive health and what this means with the loss of U.S. leadership. So with that, let's go to my interview with Anu. Hi, Anu. Thank you so much for being here.
My pleasure. Good to be with you.
Before we get started, would you like to take a second and introduce yourself?
I'd be happy to. Anu Kumar. I'm president and CEO of Ipas. Ipas is a leading international organization working to advance reproductive justice, and we focus on access to abortion and contraception.
I'm so excited to have you here today to talk about I feel like it's been a little while since I've had a global conversation on the podcast, so happy to dig into that a little bit. But I think in the moment right now, I'm really feeling this loss of U.S. leadership with them cutting off foreign assistance, particularly around the issues we work on. What are we seeing as kind of some of the impacts around that?
Yeah, I mean, as you say, there's a significant amount of resources that have been lost in the family planning community in particular. And I want to remind you and your listeners that the U.S. government has not been supporting abortion care for 50 years. Since the Helms Amendment was passed in 1973, abortion care has never been a part of U.S. foreign assistance. So that is a loss that we've been living with for decades, and indeed it's sort of the origin story of Ipas and how we came into being in 1973. We are actually over 50 years old at this point. So, there's been this bifurcation in U.S. foreign assistance between family planning, maternal health work, and then the rest of abortion care and other work that was handled by other organizations and other donors. But in the contraception world, what we're seeing is a significant loss in resources. The U.S. government was the largest donor in family planning assistance at $400 million a year, which is a lot, but to be honest, is not that much considering that the overall budget for foreign assistance was like $50 billion. And so it's, the portion that was dedicated towards contraception and family planning was really quite a small amount given the overall amount that was being spent on foreign assistance. Nonetheless, it has a really significant impact. I mean, what we're seeing now is shortages of commodities, particularly, things like condoms and IUDs and implants, and that has real life implications. And in addition to the commodities, the U.S. government was also supporting health systems around the world on how to provide care. They were paying for the salaries of many health workers in many systems around the world. So for example, maybe it would help to kind of go into a little bit of a country example. I'll talk about the Democratic Republic of Congo, which is a very significant big country in Africa, but already had very weak health systems, and as you probably know, significantly impacted by humanitarian crises. So the departure of U.S. government funds has essentially led to a collapse of its health system. And the Democratic Republic of Congo, the government, is having a hard time filling in the gap because it wasn't part of their budget, right? They were planning on having U.S. aid support as part of their annual budget. And so without it, they're really struggling as to how to fill that gap. So in that country, the support was focused on training healthcare providers, on commodities, on purchasing healthcare equipment. So without all of that, it means that there's really a crisis in the country in terms of how they're able to deliver care to their citizens. So that's one example of what we're seeing.
I think another thing that has been going on recently that is really stuck in my mind is a little bit of a departure. We're not going to focus too much on the $10 million worth of contraception that the U.S. wants to destroy because we're recording this early. So by the time y'all hear this, things could have completely changed. But as of the time we are recording this, they have not been destroyed. And there was a New York Times story that came out that said they were, and then a follow-up saying that's not true. But a USAID official statement made it sound like there was abortifacient birth control. And maybe we should just take a moment and address that bit because that is a bit of a departure, and it's really troubling to see that coming from the U.S. government.
Yes, and I think that will be the lasting impact of this episode, regardless of what happens with these contraceptives, whether they're burned or not burned. This creation of this term, abortifacient birth control, is really dangerous. So let's be clear, there is no such thing as abortifacient birth control. And it should raise a red flag for us all. It's a clear signal that the administration fully intends to roll back the right and access to contraception in general. And we're also seeing it here in the U.S. in terms of the bill that's being proposed right now in South Carolina, which is essentially using that same kind of language to call into question what they call birth control that can interrupt ovulation. I think that's how they describe it in that.
I mean, it kind of goes back to like Hobby Lobby, right?
In a sense.
Because wasn't that part of their argument, right? Like that they didn't want to cover birth control because it caused abortions?
Yes, in a sense, they wanted to carve out for contraception because they objected to the forms of contraception that were included.
Yeah,
that's exactly right. So in this bill, it basically changes the definition of what is considered a contraceptive, and they want to exclude anything that prevents ovulation or implantation of a fertilized ovum. So that rules out a number of contraceptives that we use quite frequently in the United States and around the world. But I think this is what's really dangerous about what's happening with this stash of contraception that may or may not be destroyed in this warehouse, is that they are actually equating the contraception with abortifacients. And this is not true. Now, those of us who've been working on this issue for a long time have been saying for decades that this is not just about abortion, that they are actually coming for our contraception. And they're coming for our contraception and our abortion care because they are terrified and worried about this demographic decline. But that too is kind of a cover argument for essentially making sure that the United States becomes a country where only certain people are allowed to reproduce and others are not. And I don't mean just Black people and white people, but I also mean LGBTQI individuals, people even who seek IVF, which is something that is also under attack in the South Carolina bill. So, they began with abortion, but it's a slippery road to all forms of reproductive health care, or to multiple forms.
And just to be like a little bit explicit so that you understand it's the birth control you probably could be using, right? Like it's talking about IUDs, it's talking about emergency contraception in some cases, not necessarily what's in the warehouse, but like in other instances, what's talked about. So this could be birth control that you are actually using. That is what they are targeting.
Exactly. Millions and millions of American women use or have used IUDs, emergency contraception. And I don't really know, and I'm curious to know how far they're going to take this argument, because theoretically implants and oral contraceptives could also qualify because oral contraceptives do stop ovulation.
Okay. Before we started talking, we said we didn't want to focus on the terrible. So let's not do that. And if there's one, I mean, it doesn't feel right to say silver lining because things are really bad right now without the loss of U.S. funding. But something that could come out of it is reimagining what global assistance or what this looks like and building it in a better way to dream a better system that is more inclusive and is meeting the needs of people on the ground with their input. So what could be build back better?
So I definitely want to talk about that but before we get there, Jenny, if I could just make one other comment about the role of the U.S. in the world today. I mean,
absolutely.
We definitely are and remain obviously an economic superpower and also a cultural superpower in many ways. Our music, our art, our films are extremely popular around the world. And yet, I do feel that the U.S. is slipping from its role as a global influencer because it's lost a lot of credibility in the past, not just the past year, but in many ways recently. So I was quite surprised after the Dobbs decision that we were all really worried that this was going to result in more restrictions around the world on abortion care. And we've seen some attempts for that, but we haven't seen much that's been successful. In fact, what's been interesting to observe is that many countries were so alarmed by what happened with Dobbs, particularly European countries, that they took a look at their laws and said, oh, wow, we have a barrier here. We didn't realize we put this barrier there. And they began to remove these barriers. And as you know, France actually enshrined the right to abortion in their constitution. So it had an interesting impact, and it wasn't all negative. I think the alarm and shock that it caused actually made some activists in some countries say, yeah, we can do better, and indeed we should do better, because we never thought the United States would go this far. And similarly, I think with what we're seeing with mifepristone and the attacks on mifepristone in the U.S., this is extremely worrisome. And, over 60% of abortions in the United States are done using mifepristone. They're very safe. It's a very effective method. It's a method that's approved by the World Health Organization. And yet our FDA could be poised to remove mifepristone from the U.S. market. And that would send shockwaves in the rest of the world. But it remains to be seen whether those shockwaves would all be negative. I just feel like the U.S. has really lost a lot of its leadership role certainly on reproductive health and rights, but in foreign assistance more generally. So getting back to your original question of how could we reimagine foreign assistance, I think the way that the U.S. government conducted itself in the cutting of foreign aid in such a precipitous manner really jolted people and countries and governments and made them realize that what had been a reliable partner was no longer a reliable partner. And so when it's just like any relationship, when you realize that the person you're negotiating with, the person that you're working with is actually not reliable, you make contingency plans. Right? You start figuring out, okay, well, I need to figure out how to do this on my own. I need to shore up other partnerships. I need to figure out plan, B, C, D, and E, because this is not a reliable partner. So I do think it offers us an opportunity. I mean, just recently I saw that the government of Nigeria has actually stepped up its contribution, its domestic financing for contraception. I think it went from 4 million to 13 million. So, it's a significant increase. It's not enough, but it's a significant increase, and it's definitely a step in the right direction. And so I think additional push towards domestic financing of really what are essential health services is going to be what we're going to see. One thing that gets lost in the conversation about U.S. foreign assistance, because it's so important and significant, and I don't want to downplay its significance, because the people that are reliant on malaria pills and HIV medication and tuberculosis, these are people's lives that we're talking about. And yet I do want to point out that the way that U.S. foreign assistance was delivered was far from ideal. There was always a transactional quality to it. And frankly, just as there is for any governmental assistance, the United States is not alone in this. But the fact that the U.S. is not present or is less of a player now allows recipient countries to imagine and think about how they should be providing care for their citizens. And it also allows citizens and active advocacy organizations to push their governments to actually make good on their obligations. Is it right that governments in African countries are dependent on an outside donor to provide essential health services? This is a question that the citizens of those countries need to pose and need to debate and need to discuss. Is this how we want to conduct our country, how we want to govern our country? So I think it's provoking some of those conversations, and that could be good. That could actually be a step in the right direction. A lot of the way U.S. government assistance was conducted was through contracts. And it was very project-based. It was like, we want to provide X number of services in this location for Y number of people. It was a very project-based approach. And those of us who have not been part of that ecosystem, the U.S. government ecosystem, which Ipas has not been because we do not receive U.S. government funds. We have been part of an ecosystem that is really building a movement to change, a movement for social justice, a movement for reproductive justice in the case of Ipas, a movement for gender justice. And that is a very rich and diverse ecosystem. And movement building is not project-based. And I think that could be another positive outcome of this reduction in U.S. foreign assistance.
I was thinking kind of along similar lines of there had been a big push around like integration of services, but there were funding streams, right? It was like, here is your HIV assistance, here is your family planning assistance. And with things like the global gag rule that reinforced keeping sexual and reproductive health separate from other forms of healthcare, but that's not how people live their lives, right? That's not how you want to access services. You want to be able to go to a clinic and have all of your needs met and not try and find a clinic where you can get this or a clinic where you could get that. So this could offer a great opportunity without having those restrictions that the U.S. government had with global gag rule, Helms, right? You can bring abortion services in from being separate. You can have a clinic where you can go to get health care instead of having to go to multiple places.
Exactly right. And so without the U.S. foreign assistance or a significant reduction in it, we have a reduction in the impact of the gag rule and the Helms Amendment. So that's right. The thing that's worrisome, though, is that most of the countries that we're talking about are so poor and are so much in debt that it's going to be very difficult for them to resist American money. They need it. They need it. And it's very likely that future American money is going to be even more heavily conditioned. And I mean, it remains to be seen, but very likely that the gag rule will apply to all foreign assistance. It could apply to more than just foreign NGOs. It could apply to U.S. NGOs. It could apply to multilateral organizations. And they might include more kinds of services and care, like gender-affirming care, or who knows about DEI. There's a lot that we don't know what's going to happen, but it's very likely that it's going to be even more, I would say, transactional and ideologically restricted.
And you all may already know this because it may have happened between the time we recorded and it came out, but we will have a much deeper dive on what happens with the global gag rule when it actually happens. But yeah, no, it could have a much broader impact. But again, thinking of the possibilities of, not aid coming from a top-down, this is what we're doing, but having communities more involved and what they need is like a great vision for the future to think of building it to be more justice focused than just top-down outsiders saying, this is what we're giving you.
Yeah, and I think those conversations are happening. There are discussions and conversations that are happening both at the country level, and I know that Ipas staff and colleagues are involved in some of those discussions about health financing, but there are also conversations that are taking place at the global level about what do we do. I think the most difficult thing has been the speed at which USAID was dismantled.
There was no preparation for anybody. And how do you fill that gap when your budget's already committed and you weren't expecting to all of a sudden lose all of these services or supplies that were provided?
Exactly. And, in addition to USAID, UNFPA has also been impacted. And so this is also an issue because so many of the reproductive health supplies and commodities are purchased by and through UNFPA. So, we're looking at a situation where some of the leading organizations are actually really hard hit. And then, of course, the NGO sector is, particularly those organizations that were dependent on U.S. government funds have just been really decimated. And so many staff and individuals have lost their jobs. And then, the impact on real people's lives in country, the beneficiaries of U.S. government assistance is also significant. So the ripple effect is just really profound. And I think everyone is trying to adjust to this new reality. It reminds me of the way that I've been reading about how the economic world order is also being reimagined and kind of reshuffled because the U.S. is not, because of the tariffs. So, China actually has, it's doing well in terms of exports because it's found additional markets. Brazil is exporting more to China and other places than the U.S. because the U.S. has imposed these tariffs. So the world is kind of adapting and realigning in real time. I mean, like, we're seeing this happen. There was that the meeting the summit that took place in China, which included Russia and North Korea, and those leaders. People are looking and saying, all right, well, maybe the United States isn't this where we should center our world.
Yeah, and you were talking about like the ripple effects, and I'm sure you experience the same thing that I do. Is you go into the next meeting, and all of a sudden someone else says something, and you're like, oh my God, that's like another thing I hadn't thought about yet. And so it always feels like there's some new nugget of information or area impacted that it can be so overwhelming to just think of all of the places that need our attention and focus. And yeah, I just feel like in every meeting or conversations I have, all of a sudden it's like, oh, yeah, no, I haven't thought about that yet. Okay.
Yes, I do feel that. And I know that my colleagues do as well. And one of the hardest things in times like this, I think, is to kind of stay steady and stay the course. And I have the great advantage and benefit of working in an organization that's really focused. Ipas is focused on access to abortion, access to contraception. This is what we do. We don't do 100 things. We do this thing. And so, part of the benefit of that is that I can kind of keep doing my job and, keep at it and try to filter out some of the stuff that's happening on the outside. Though obviously it's challenging because it all impacts, our work. But I think that, to me, that's like the thing that we all need to kind of embrace is almost a single-minded focus in terms of, what are you good at? What can you do? And do it, do it the best you can right now. And that is actually the only thing that we have control over. I think the other feeling that a lot of people have is just the sense of chaos and disassembling and kind of, keeping track of everything, which is impossible. Yeah. It's impossible to keep track of everything. So.
And like forgiving yourself for not doing it all, right?
Well, there's no way.
Right? So I'm one of those people who feels like, oh God, I need to do more. Like I'm not doing enough. And like giving yourself the grace to know, like, here are the couple things that you are going to focus on, and trusting others have the other areas, and
exactly.
And you can't do it all.
Exactly. Yeah, exactly. And I firmly believe that that reproductive justice and gender justice, I firmly believe that we will actually prevail. I think it will be longer in the United States, but I just want to remind your listeners that in the last 30 years, 60 countries have liberalized their abortion laws. Only a handful of countries have gone backwards. Yes, one of them is the United States, but the progress is unmistakable. Like, we are moving towards a world in which this issue, the issue of access to abortion, is less and less a politically divisive issue. Obviously we're not nowhere near that in the U.S., but I do think we can get there, and we just have to kind of continue down this path and continue down this road. And one of the things that we're doing, at Ipas, is to kind of keep that focus and bring the lessons from outside of the U.S. to the U.S. American activists, I think, we have a lot to learn from the rest of the world. Not only can we learn, but we can also gain inspiration and hope for what is possible. Like, I'm thinking about the Green Wave movement, in Latin America. And what was so powerful about that movement is that it was a movement that brought in so many other movements. So, it was like a collation of multiple movements, And so It was the feminist movement, it was the labor movement, it was the LGBTQI movement. It was just many groups that got together, and that's why I think it was so powerful. And that, I think, is something to really learn from and draw strength from. And another feature of that movement that was also really interesting to me is that over many, many years, and remember, Latin America, many of the countries in Latin America emerged from dictatorships. And so they are very nascent democracies in many ways. And so they, the fact that they were able to actually bring, to have people who were both in power, who were on the side of, changing the gay marriage laws, changing the abortion laws, and as well as sort of activists on the street, it's like those two groups working together, I feel like really led to significant change, in the corridors of power and in the streets, meant that change was really possible. And that's something to aspire to.
Yeah, I feel that so strongly. I've done other interviews where people ask, how do you keep doing this? Do you honestly believe we're going to win? And if I did not believe that, I could not do this work, because there is so much where you could just see the ways we have lost and things that aren't going well, that if you didn't think that we would achieve that better world, you couldn't do this work. And so, I come into it with hope, and, it may not happen as fast as I would like, but I absolutely believe we will get to that better place where people have access to the care they need, and in all the ways, right? That's affordable, it's local, it's easy to access. I fully believe in that vision. And if I didn't, I would give up.
Yeah, exactly.
Okay. So I always like to end the podcast not talking about what's bad, but talking about what people can do. So how can the audience get involved in these fights right now?
So, I think the best thing we can do is to really be as informed as possible. So there's great information out there on what's happening on abortion rights. Of course, Ipas's website, www.ipas.org, is a font of information about what's happening around the world and what we can do to improve the situation. I do think that there are organizations, so NGOs are still active in this sector, and so nonprofit organizations are still really moving and still acting despite what's happening at the governmental level. And there are many partner organizations. So Ipas obviously is an organization that one can support, but then there's IPPF, there's Marie Stopes, there's there are many, and then of course there's Planned Parenthood locally, and then the reproductive justice organizations, the abortion funds. The abortion funds are really, really critical. Personally, I feel like they are providing much needed help to individuals in our country, and they had an initial surge of funding post-Dobbs, and that's really waned. And so I feel like additional support to the abortion funds is really necessary, and many of them are working in places that are restricted, highly legally restricted. So, I think there's a lot of opportunity there as well. There is no shortage of ways of getting involved right now. Just need to kind of think about it for a second, for a minute, and maybe do a little light Googling, and you will find ways of getting involved.
Yeah, you talked about the green wave being something that inspires you. And yeah, the work that abortion funds are doing on the ground, I find so inspirational, and always a big fan of supporting them. And all the places you mentioned. And my note I like to give when people talk about donating, particularly to abortion funds, but to anybody, is it's great if you can give once. But if you can break that up and be a monthly donor, and even if it's small amounts, they know they are getting that amount every month, and that helps them plan. So I'm a big proponent of being a monthly supporter, and I am a monthly supporter of multiple abortion funds.
Yeah, the recurring gifts are really important. Yeah, it also sends a signal of solidarity, that you're in there for the longer term. It's a sense of, and a feeling of community. One of the things that we've been doing at Ipas in many different locations is we've been leading a book club called Read to Resist. because one of the things that has this might be cheesy, but I really do feel like your mind is your own. What you think and what you learn and what you put in it is under your control. And so I have always drawn a lot of inspiration and not to mention learning from reading and pleasure, just enjoyment. I read all the time. I read fiction, I read nonfiction. Yeah. So we began this book club, and right now we meet at a local bookstore here in North Carolina. But we also, the information about the book club is on our website, and there are book recommendations as well on our website. And I find that reading about how other movements have handled times of oppression is instructive. And I also find, like, for example, we read The 7 Necessary Sins for Women and Girls by Mona Al-Tahawi, who is an Egyptian feminist. Getting her take on, as an Arab Muslim woman, what does she think of what she's experienced and feminism and women's rights right now? It's just a different perspective, a different take on the same issues that we've spent a lot of time thinking about, and bringing together a book club to talk about it is also really helpful because you have this sense of community and discussion and, what did you get out of it? So anyway, I encourage people to kind of create their own communities and figure out ways that they can maintain their level of hopefulness and inspiration. And, we're not the only people to have experienced this. Other people have experienced this kind of political climate, and we can learn. We can learn from them, and we can grow.
I love that, and I will be going immediately to go and see what is on the list, to see what I need to be reading. I always love getting new book recommendations to add to my to-read list, which is endless, but still love to add more. Anu, thank you so much for being here. It was a pleasure to talk to you.
My pleasure.
Okay, y'all, I hope you enjoyed my conversation with Anu. Don't forget, win free merch, tag us on social media in whatever format you would like, whatever platform you are on. Tell us why you love the podcast, or tell us why you fight for sexual reproductive health and rights. And each time you post and tag us, you get put once in the pot to win a bunch of Repros merch. So can't wait to see who wins. Can't wait to see y'all's posts. Like I said, I really love hearing from y'all. I really am excited to hear what you love about the podcast and what makes it special. So thank you so much for everybody who is going to send in their stuff. I can't wait to see everybody at APHA, and I will see everybody else next week. If you have any questions, comments, or topics you would like us to cover, always feel free to shoot me an email. You can reach me at Jennie, Jennie, @reprosfightback.com, or you can find us on social media. We're at Repros Fight Back on Facebook and Twitter, or Repros FB on Instagram. If you love our podcast and want to make sure more people find it, take the time to rate and review us on your favorite podcast platform. Or if you want to make sure to support the podcast, you can also donate on our website at reprosfightback.com. Thanks all.